Hello everyone, this video is about hypothermia in infants. So in infants, the normal body temperature is 36.5 to 37.5 degrees Celsius. And the site that we use to measure this temperature is the apex of the axilla, and we do it for a period of 3 minutes. So hypothermia is when the body temperature of the infant is less than 36.5 degrees Celsius. Hypothermia, based on the severity, can be divided into three types. The first one is cold stress. In cold stress, the body temperature is 36 to 36.4 degrees Celsius. Moderate hypothermia is when the body temperature is from 32 to 35.9 degrees Celsius. And severe hypothermia is when the body temperature falls to below 32 degrees Celsius. When the child has hypothermia, it can present with clinical features like hypoglycemia, hypoxia, metabolic acidosis, and bradycardia. The reasons why newborns are so prone to hypothermia is because, especially in preterm and small for gestational weight infants, brown fat is scanty. Brown fat is responsible for thermogenesis in infants. If this will be scanty, these children, preterm and small for gestational age children, will be more prone to hypothermia. Along with that, children also have a large body surface area. So a larger surface area will cause more heat loss from the body. Along with that, the shivering mechanism is absent in infants. So there is no heat production by shivering. And this is also why hypothermia is so common in infants. Management of hypothermia in infants will depend on the degree of hypothermia or the degree of severity of the hypothermia. If it's just a cold stress or moderate hypothermia, then skin-to-skin contact with the mother, frequent feeding, and increased calorie intake in the infant is recommended. This should be enough to raise the body temperature. Skin-to-skin contact with the mother, giving frequent feeds to the child, and increasing calorie intake. Whereas in severe hypothermia, we have to use either a radiant warmer or an incubator. Now, a radiant warmer is open and an incubator is closed. A radiant warmer uses the mechanism of radiation for heating, whereas an incubator uses the mechanism of convection for heating. You can also remember this by a mnemonic. Radiant warmer will use radiation, whereas an incubator which has a C in it will be closed and it will use convection for heating. Apart from that, oxygen, IV fluids and antibiotics also have to be given.